Government Benefits Part 1. Government benefits are administered by different government programs at both the state and the federal level. The government programs administered by the state are often funded by the state and administered there as well, while the federal government programs are often funded at the federal level but administered at the state level, where the federal government gives the different states money to allocate different programs. There are many different types of government benefit programs. We're going to be talking about a few of them in this three-part series. First is disability insurance. We'll talk about Medi-Cal and Medicare, Social Security, SSI, and veterans benefits. The goal of our discussion is going to be to try to figure out how to help a client who comes in with the need for a certain government benefit program. And so we want to know how to help the client. The first question we want to ask is, what does the program do? Then we want to ask who administers the program so we know where to send them. And then we want to ask who is eligible to receive the benefits to make sure that we don't send them somewhere where they're not able to get help. So first we look at what the client actually needs. When we can identify what the client needs, we can match them up with a particular program to make sure that they're getting the help that they're requiring. A lot of different programs give medical care coverage, and other programs give, for example, financial assistance. The financial assistance could be because of a disability, or it could be simply due to the low income status of the particular participant. We want to be able to, after we have identified which program would suit the client, let them know where to go. So we have to know who administers the program. There are a lot of government offices out there, a lot of social services agencies, lots of nonprofits, and although they're all trying to help your client, they do a lot of different things and don't necessarily always overlap. And so we want to make sure that we give the client the proper information, and so they're not bouncing around to different organizations and different offices trying to get the help that they need. Oftentimes, a lot of the people are not particularly up to date about where to go for different programs, and so being able to give them the proper referral the first time is very important to them in helping them to get the help that they need. Then we want to know, can the program actually help the client? We've already determined that the program itself works in the area of the need that the client has, but we're not sure whether or not the client is eligible to receive the services. So we want to know who is eligible to receive benefits under this particular government program. Eligibility is a huge question, and most programs require either U.S. citizenship or U.S. residency, or if it's a state program, state residency, in order for the clients to be moved along in whatever program that it is. And there are going to be many other eligibility criteria that they're going to have to meet to receive assistance under each program. So let's start with disability insurance. Disability insurance helps disabled workers who can't work, and it is based on salary or wage history. So basically, what they're doing is giving financial assistance, monetary assistance, based on the salary or wage history of the particular individual. And so when we're looking at what does the program do, these particular programs, and we're looking at two here under disability insurance, give financial assistance. So they're giving money. That's what they do. So if your client has a situation where they're actually needing financial or monetary support, then this might be a resource which they can use. Let's look at two different programs, one on the federal side and one on the state side. We have federal Social Security disability benefits, and then we have state disability insurance, which is also known as SDI. So now that we know what the program does, let's see where to go for federal Social Security disability benefits. These particular benefits are administered through the Social Security program. So remember these when we're talking later on about Social Security. If you have a client who might be interested or eligible for these programs, you should go to the Social Security Administration office in order to apply. Now the question comes up, are they eligible? Can they actually be helped by this particular program? The criteria that you must meet in order to receive federal Social Security disability benefits, obviously they are disability benefits, and so the client must be disabled. Now, disabled is a term of art. It has a specific definition which goes along with it. In this case, it can be a physical or a mental impairment, but this particular impairment must do a couple of things. It must prevent you from doing any substantial gainful work, and it must be expected to last at least 12 months or result in your death. Substantial gainful work is defined as where you can get more than $1,040 per month. So if you have a physical or mental impairment which prevents you from doing any substantial gainful work, that means that even if your client was able to work, they would not be able to get more than $1,040 per month out of this work. Now, the reason that 1,040 is in bright red, bold numbers here is because this is a new law which was enacted. So the ceiling was actually lifted from $1,000. And your textbook actually might still say $1,000 because it's printed. And every time something's printed, it's dated as soon as it comes out. So these are the new numbers we have here, $1,040. And so if you had a client who before was not able to meet eligibility criteria because they could do work which say would earn them $1,020 per month, they might not have been eligible previously, but now they have a new shot at eligibility since that ceiling has been lifted a little bit. The impairment, it must be expected to last at least 12 months or result in your death. So this is something which the disability is going to be with you for some time. You don't have to have had it forever, but it's something which now the client suffers and is going to be with them for the long haul. And then this disability must be verified by the physician which is treating them for this disability. The second big criteria we have for eligibility is a required number of work credits. What work credits are is a number that is calculated by Social Security of how long you've actually worked and how much you've paid into the Social Security system. If you're currently working, or if you've ever worked and you've received a pay stub, somewhere on that pay stub is going to be a line for how much was taken out of your paycheck going to Social Security. This number is built into your Social Security account, and it's calculated by Social Security to see how much money you've actually paid in over time. Based on the number of calendar quarters you worked and where you paid into Social Security while you were working is going to come this number of work credits. Now, this creates a problem for folks who either have not worked their entire lives and so have not paid into Social Security and therefore would have no work credits with Social Security, or folks who perhaps worked under the table or worked at jobs where they were not taxed Social Security and that didn't receive a pay stub, because then Social Security would not have any record of their work, they would have developed no work credits, and so they would not be able to avail themselves of federal Social Security disability benefits. So let's take a look at state disability insurance. Perhaps if you have a client who couldn't get federal benefits, this is something that they might want to look at. State disability insurance is administered by EDD. EDD is the Employment Development Department. So here in California, you can go to ca.gov and take a look at the Employment Development Department, and they will show you where your local SDI office is, where you're going to go and apply for this particular program. Now, because all states are different, outside of California might have a different program or not have a program at all. So you want to take a look at your local development department or local employment department of your particular state to see what type of state disability insurance or benefits might be available for people outside of California. So how can you be eligible for state disability insurance? First off, we have a very large difference between the federal program in that you can be temporarily or permanently disabled. And so while in the federal program, clients could only make use of it if they had a disability which was going to last for 12 months or result in their death, in the state disability insurance program, we have a temporary disability also built in, which people can make use of eligibility as an eligibility criteria. Still must be doctor certified, but in this case, The particular disability must be a non-work-related disability in which it's an illness or an injury, which can be physical or mental, which prevents you from doing regular or customary work. Examples of temporary disability, which really is the thing that sets SDI apart, would be elective surgery or pregnancy, childbirth, adoption actually is included there, and other related conditions. So you can see how many of these particular situations would create a temporary disability, but they would not last, say, for 12 months. And so we have a different situation here and a different group of clients who may be able to make use of SDI. Other examples of temporary disability are being quarantined by a health officer, or if you're in treatment in a residential facility for alcoholism or a drug-related illness, drug-induced illness. So this can help you while you're going through those particular programs.